Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It is also sponsored by Zyga Healthcare Group, a leader in providing senior living, home health care, and hospice-related services throughout the entire DFW Metroplex. My name is Sylvie Simon, and I will be hosting your show today. You can watch us live on Facebook, on our Facebook page, and after the show, head on over to our YouTube channel, Doc Talk Live, and like, comment, and subscribe to see the great shows we have scheduled in the upcoming weeks. More details can be found on our website, doctalklive.com. If you're a healthcare professional and would like to be on our show, please send us a request through our website or through our Doc Talk Live Facebook page. So again, welcome back everybody to Doc Talk Live. So no one wants to make that unfortunate trip to the emergency room. However, many of us will at some point in our lives face a situation where we really have an emergency and we need to go to the ER. Today, ladies and gentlemen, we have a great show on just that, the emergency room. And joining us live in the studio is ER physician Dr. John Turner and RN Miss Terri McKenny. So to be a part of our conversation to discuss the topic emergency room, please call us at the studio. The number is 972-235-5555. Again, the number to the studio is 972-235-5555, and we'll be happy to take any questions you guys have. Dr. Turner and Miss McKenny, welcome to our show, Doc Talk Live. Thank you so much for being here. Please do tell the listeners a little bit about yourselves and your practice.
Well, thanks for having us today. We appreciate letting us be here. So we have Uptown Emergency Room right there on Oak Lawn Avenue, just a little north of Lemon Avenue. If you know where Papa Do's is, or Lucky's right there. We took this center over about a year ago and have been building a stable reputation for solid emergency care that, for the most part, is priced appropriately. You know, I think there's a misconception out there that emergency care is expensive. It is, but it doesn't have to be too expensive. It doesn't have to be scary expensive, and I think there are some centers that they are scary expensive. We try not to be like that. We try to be appropriate. And you know, I think what we just won Reader's Choice Award, the Dallas Voice, for Best ER in Dallas. So and we didn't even know we were in the running for it. So you know, I think our reputation is building, and we're happy to be here.
McKenny?
Hey there. I've started with this ER about a year ago, and I am now the director. I've been a nurse for 33 years, with critical care, ER, actually, and flight nursing also. So I'm very experienced. I can even deliver a baby if I have to. And all our nurses are very experienced also, critical care nurses.
Awesome. Well, thank you so much both for being here. So it turns out 1 in 4 Americans visit the hospital ER, or they have in at least the past year. So if you guys can start off by explaining to us what exactly is a freestanding ER. Dr. Turner?
So these things got popular probably 6-7 years ago, and I think it stemmed from overcrowding in the ERs. Everybody knows you go to an ER, you're probably going to be there 2, 3, 4 hours, 5. Parkland, not uncommon to be there 12, 20. Waiting to be seen. So some smart, savvy doc decided, hey, why don't we put these out on the street corner and make it more accessible to the average Joe? Now, when they started out, insurances weren't paying them. CMS, so Centers for Medicare and Medicaid, weren't paying them. They still aren't, actually. And so they really had to open up in more of the affluent neighborhoods. I think that also kind of unfortunately carries a stigma with it that, you know, you're cherry picking when you open up some of these freestanding ERs to just be in a more affluent area. But until CMS decides to recognize us, and I think when they do, you're going to find that these are opening up in all kinds of underprivileged neighborhoods, and they're going to be a great resource for those communities. But at the moment, they're in, you know, more of the neighborhoods that are going to be better insured. But that's unfortunately a necessary business aspect to it. And at the end of the day, let's face it, medicine is still a business. We like taking care of patients when they're sick, but there is a business aspect to it. And so physicians started opening these things up, and then they got legislation on their side from the state of Texas that said if you're going to present yourself to an ER, it doesn't matter what ER in the state of Texas, that insurance is needed to pay you. And as soon as they did that, ER doctors started running to opening these centers up for a myriad of different reasons. But probably some of the biggest was that they got some control. They got the ability to open up a center and deliver care the way they wanted to deliver it. Yes, they made good money doing it too, but there was that aspect of getting out from under the kind of fingers of your classic hospital administration, and now you get to run the center. If there's staff that are an issue, you get to address it in your way, as opposed to having zero control over that in a hospital setting. So it became fun for a while. I think then, as in a lot of instances, maybe a little overzealousness with doctors opening these things up, and I think I heard this complaint from a lot of people that these things seem to be opening up on every street corner, and they were. A lot of them have shut down now at this point. There's been some market correction to it, and I think you'll see this will start to stabilize, and these things are here to stay.
Okay, good. For those just tuning back in, this is Doc Talk Live. We are live in the studio with Dr. Turner and Ms. McKenny. They are discussing emergency room and emergency room topics. And so, Ms. McKenny, can you, and just to remind everybody, the number to the studio is 972-235-5555. Again, that's 972-235-5555. If you have any questions, please do call for our expert. Ms. McKenny, can you explain to us what is the difference between the traditional ER and urgent care centers? As in, why would somebody go to an ER versus an urgent care center that we see also on several blocks?
Okay. I would just say that urgent care would be more something that you would go to your family physician for, such as a cold, an earache, a rash, that kind of thing, versus going to an emergency room where you need more emergent tests, more extensive tests. Also, the ERs are open 24 hours a day, 7 days a week, holidays, and the urgent cares generally aren't. They are open some on the weekends, but a lot of our patients come in because of the hours and the availability. And we can do additional tests that urgent cares can't do. We do x-rays, CAT scans. We can take care of you if you're having chest pain or having a baby, versus an urgent care that would not be able to do those kinds of things.
Okay. And Dr. Turner, you said you guys work, your ER is known as Uptown ER. And what kind of staff can we see when we go there? Are there physicians on a full-time basis, nurse practitioners? Can you explain to us?
Yeah, so any of these freestanding ERs are going to be staffed 24 hours a day by an ER physician. They're also going to be staffed by a registered nurse. There'll be a radiology tech there to administer either the CAT scan or the X-ray studies. We keep ultrasound techs on call, so when we need to do ultrasounds, we just call them out. Usually they're about half an hour away. Front desk registration, and then during our busier times, we may or may not have an additional tech. We don't staff with mid-levels. It's pretty much just going to be the physician and the RNs.
Great. Let's take a live caller. Hi, welcome to Doc Talk. What's your question? Hi, welcome to Doc Talk. What's your question? So I believe the question again is similar to what you had answered, Ms. McKenny, but what is the difference between an urgent care center and an emergency room? And is there a difference in the co-pays?
There's a big difference. ERs are a much more expensive place to deliver medicine, right? You have to have 24 hours with board certified physicians, all the technology in there with the resuscitating equipment, the full lab, the on-site pharmacy, the CAT scan, the X-ray, the ultrasound. All that's quite expensive to put in there. So to deliver the care from an ER is just more expensive from the onset. So of course it's going to be more expensive to go there. Your copay is going to be higher. You know, historically you kind of classically thought your insurance would have a $200 copay. This stuff's been changing. It's been morphing from year to year, and it's very hard to stay up to date on it. The insurance companies kind of always keep us off step with them. So, you know, as best as I can describe it today, and don't quote me on this exactly because it's going to vary from insurance to insurance, but you can probably look at an urgent care copay being somewhere around $50, and an ER copay being anywhere from $200 to $300. And if you have a high deductible plan, there is no copay. It's just it's whatever your deductible is, and so you could wind up being on the hook for $1,000, $2,000, $3,000 of the bill, depending on what you were there for.
And that's quite impressive too, because if you go to a lot of, I think what the issue is, a lot of patients and all of us, there is a little bit of wondering why one should go to urgent care versus an ER, but that is something to look out for, because at the end of the day, even if you go for a sinus infection, to the emergency room, you do have to watch out for some of those copays. So.
And may I add, there is definitely an appropriate time for an urgent care. We're not, we'd love for people to come to the ER, but for a simple, a cold, and you just need, an inhaler, or, that's definitely appropriate. And your insurance would appreciate that probably too. But
good point. Let's take another live caller. Hi, welcome to Doc Talk. What's your question? Hello.
Hi.
Hi.
That's a great question. So the question is, how about if you don't have insurance? Can they come see you at the urgent cares or the emergency room centers?
Yes, absolutely. We have a self-pay rate, a very nice, deeply discounted rate for people that don't have an insurance policy. So we will see anybody.
And that's per service rendered, or how does that usually work?
It will vary depending on what we have to do.
Okay.
I mean, if you came in with something very simple, you may only owe a couple $100. If you came in with something very significant and required a lot of workup and a lot of treatment, we cap all of our out-of-pocket charges, so it will not get higher than $1,500. So you could go to another ER and wind up with $3,000, $4,000, $5,000 bill that you are personally responsible for, and we won't let that happen at our center.
And as far as so as a lot of people don't have primary care doctors. So do you see that? Do you guys pretty much become a patient's primary care doctor?
We're not a primary care doctor, but we do have some people that, like you said, can't get into one, or they've let their medications run out, and we're glad to see those people.
So guys, we're about to go on break. We are, just to remind everybody, we are in this live in studio with Dr. Turner and Ms. McKenny. They are owners of Uptown ER, and they'll be discussing any questions you have regarding the emergency room. The number to the studio is 972-235-5555.